Hey, deserving listeners, it's time for part 2 in which I react to Teal Swan's video from 2019 titled Teal Swan's Stance on Suicide. Let's watch. My name is Dr. Kirk. I'm a therapist and professor. Let's see what comes out of my face as I watch.
Telling them not to think about suicide is like telling a person who's worried not to think about what they're worried about.
So she's saying that all we do is tell people not to think about suicide. Again, might some clinicians do that? Yeah, I know of cases like that. But certainly people that know what they're doing would not do that. Meaning that we would never just have a client and say, don't think about that. I mean, that's an oversimplification by far.
Telling a suicidal person that if they do commit suicide, they're going to ruin other people's lives. It doesn't actually work to make them feel better. In fact, it makes them feel worse.
That might be true for some, but it's not true for everyone. I guess I need to start categorizing undertrained therapists and counselors and psychologists that don't know what they're doing and specialists that do know what they're doing. So for the clinicians that don't know what they're doing, I'm sure there's a spectrum there, but if we're talking about that side of things, and they might be trained and they might have this knee-jerk reaction or a part of their treatment that they will say, you know, if you attempt and you die, you're going to disappoint a lot of people in your life. And what she's saying is that universally clients it'll make them feel worse about themselves. And okay, maybe for some, but for others, it could actually help them. In fact, most of the time when I hear this phrase, it's coming from clients themselves. They will say, well, I would never do it though, because I couldn't disappoint my family or my kids in that way. And so that's a big reason why I don't do it. And so we might even use that in therapy as an initial motivation to stave off attempts so that we can start to address the issues that are underlying the thoughts.
Because on top of feeling as bad as they do, bad enough that they're actually considering ending their life, now on top of it, you've just added the pressure of other people's feelings, the responsibility for those feelings of the people in their lives, and the guilt on top of it.
I'm just going to take a guess and say that many of her followers and students, clients, I don't know what to call them, people who come to her for help, they did go to a therapist and it didn't go well. And then when they come to her, maybe she only hears those stories because if they're seeking her help, they are a self-selected group of people that either were mistreated by a therapist, which does happen. Believe me, as a podcaster for 14 years, I started getting a lot of emails from people who had been mistreated. If even a minority of them are true, there's a lot of incompetence in my field. And I also review legal briefs of therapists who are being sued in court, civil court, and also having their license sanctioned by the state licensing board. And I've also been called as an expert in some of those cases. And I've talked with a lot of lawyers, and there's a lot of stories, actual documented stories of therapists that clearly have no idea what they're doing. I mean, and then of course, just flat out abuses that very rare therapists will commit. But that's not the general rule. Just want to say that. And things are always improving. You know, one of the things that I can point to along these lines is that when I was trained as a therapist in the 90s, my master's degree was only a 2-year program, maybe a 1.5-year program, meaning that to be able to get a master's degree and qualify as a master's level clinician, you only needed about 18 months of training to get there. And if we rewind the clock another 10, 20 years, the program was like 1 year long. Well, today, the typical master's programs are 3 to 3.5 years long minimum. And that's because more and more topics are being added to the requirements to get that degree and to get licensed. And I'm quite sure that specialized education in suicide and suicidology and suicide prevention and treatment will begin to be mandated by accrediting bodies and by licensing boards. In fact, in my state, it's mandatory that we have continuing education around suicide, I believe every 5 or 6 years. So there's an increased awareness, and what ends up happening is degrees get longer and more expensive is the thing, but perhaps it's important to do that. I would agree with that. By the way, just so y'all know, you're saying, well, if you have a master's, I went back to school after I got my master's and got another master's and a doctorate degree. So
what if there was another way that worked better?
Oh, sorry. What I was going to say is I'm guessing a lot of people come to her who have been mistreated and thus are telling her stories, and maybe that's where her distortion comes from. Everyone anecdotally that she's talked to has had a bad experience in therapy with someone that didn't know what they were doing and were doing what she's describing here as the very insufficient and ineffective and also dismissive style of treatment for people who are thinking about suicide. And then she believes that she's the only one that knows better.
What if this way that worked better seemed counterintuitive to people who are on the outside looking in? What if we could say to people, okay, I'm going to humor you for a minute. In this safe space that we're in, what if we actually do look at these emotions that you have about suicide, look at the thoughts about committing suicide? What if we consciously play out the tragedy of this suicide?
Okay, well, that first part is, yeah, that's great. Think about the feelings. The second part is questionable. And I know because I've seen the documentary and listened to the Gateway podcast that the accusations against her, and this video she published in 2019, which I think is in response to the Gateway podcast that came out about her, I don't know. But in the past, and maybe she'll get into it here, but in the mid-20 teens, her approach to suicide had a lot of controversial methods, including having people visualize their death. Someone would come to her, or she'd lead a group of people, and she'd say, okay, all y'all who think about suicide, I want you to actually imagine how you're going to die and really go deep. Don't just briefly, she would walk them through a visualization process, and now you're dead now. And then she would have them think about being dead and what happens after they're dead, and these kinds of methods. And for people looking in from the outside, and that's all they hear, it looked as though Teal Swan was doing this encouragement, or at least doing a very irresponsible treatment method to help people with suicide that might actually result in people actually dying. And what I'll say about that is, on the surface, it could be a risk, but it's not automatic, right? It looks that way to people. And I think some of the criticism against her is actually part of that death and suicide taboo. That, in fact, if it was to broaden this out a little bit, there's a myth, a very common myth, that if you talk with someone who is thinking or even not thinking about suicide, if you ask them if they are thinking about suicide, it will provoke them to think about suicide or to try to commit. So if you're a teacher in a school or you're a friend, there's this myth that if you say you have a friend or a student that has thought about suicide, you should never bring up the topic because that will trigger them to attempt or complete suicide or something. And that's a huge myth, and it really hinders our ability to help people like this. It's this further distancing that happens to people who are going through this. Now, if you're a teacher, you shouldn't just ask, you should actually seek someone's help. If you're a friend, you should obviously seek, just asking someone isn't going to help them necessarily, but not asking them is also not helping them necessarily. So for her to even talk about suicide at all, I think it provokes that uncomfortable feeling that people have, and then they just attack her and they just say, like, you're irresponsible. And I will also say that she has been accused of increasing the risk of suicide and being a factor in people completing, because a number of her followers have actually died from suicide. And what I'll say to that is, we don't know, because we'd have to do research. It's possible, but it's also possible that her treatment is either no different from the standard treatment, meaning specialized treatment, or it's maybe better. Who knows? But I doubt it's better. We would have to actually do a study where we have people with similar demographic backgrounds go to specialists like me, people who don't go to anyone, maybe people that go to therapists that don't know what they're doing, or just any old therapist, and then people who go to her, and then you'd have to compare the rates of actual death by suicide. And we'd have to control for demographics and all that kind of thing, because that's what we do in my field. When we are trying to determine the effectiveness of treatment of suicide, that's what we do. We actually gather the data and try to figure out different models, different methods, different protocols that will actually reduce the risk and help people. I could bore you with the research, but everything that I'm telling you and have told you thus far about suicide is all based on that empirical observation. So my point is that just people attacking her and saying some of her followers have died by suicide and thus she is irresponsible and harmful to people. We just don't know. It could be. And to assume that that is true, I don't know if that is very wise. Now, she doesn't have any credentials, right? So she has no education, no license. I'm licensed, meaning that if I was to do something that was unethical or harmful, then my license would be taken away. It's the same that if you have a driver's license, that you need a driver's license to drive because we need to determine that you have not only passed certain educational requirements and testing requirements, but it also means that you haven't done anything that has resulted in your license being taken away. And the same is true in any kind of treatment like this. The fact that she's not licensed, she could do harm to people, but there isn't a way to prevent her from doing what she's doing, right? If I do harm to people and the licensing board takes away my license, I can no longer provide treatment. That's why we have licensing. That's one of the reasons. And so the other thing is it could be illegal, and I do plan on going into this in more depth as I go through this series about Teal Swan. What's the difference between a self-help guru providing self-help and someone who's providing treatment? We do have a lot of language and research regarding delineating those things, but a lot of people in her camp, religious people, self-help people, authors, YouTubers, people on TikTok are seemingly providing treatment for particular disorders, but there's clearly a gray zone there. And does she live in that gray zone, or is she absolutely stepping into treatment of people? But anyway, I'm rambling. Let's watch.
We see the impact on the family. We see what happens after this initial relief phase that they think they're getting. We introduce them to the what then, after death. What if this counterintuitive way of going about approaching suicidality actually is what enables a person to see that the best choice for them is to commit to life?
Right. So what she is talking about is something that people in my field do sometimes. It's not the go-to method, but it is something that we will do. And it is a method that's been in my field for decades. We could consider it to be an Albert Ellis, REBT sort of thing, an existential question, like the way Viktor Frankl would work with people. That the thing she's talking about, we've been doing for decades and decades. It's a well-known method of trying to help people, and it does recognize that these questions are sometimes really quite provocative and from the outside might seem very risky, but if you don't have other options, it can be really helpful. So what she's talking about is, instead of the constant liminal space of being like, I'm thinking about dying, but I shouldn't be thinking, because, people who have suicidal thoughts, they always have thoughts about not wanting to die. Everyone, there's always a tension there. There's a part of them that wants to die, and there's a part of them that doesn't. And it'll vacillate over time usually. And so they'll be in this constant battle, and sometimes it's helpful to say, okay, just hypothetically and just temporarily, let's take away the fight. Let's take away that side of you that is saying, don't do it. And let's just play it through. Let's actually look at what happens. And when we do that, some people will realize, oh, I guess it doesn't really solve my problems. And that can help with motivating someone to not do it, or it can be part of that motivation. So yeah, what she's talking about is a very commonplace method that people will use.
There's a push right now for it to only be legal for licensed professionals that are trained through mainstream education to be speaking about the mind and about emotions.
Okay, so the first part of that, I thought, well, yeah, we need some sort of government oversight. We can't have people walking down the street and saying they're a dentist or they're a physician or they're a therapist. We need licensing procedures, the minimum requirements of education, oversight, this kind of thing. Yeah, so the first part, she's like, there's this movement to make only those in mainstream psychology that are able to do that. And I'm like, well, yeah. There's nothing preventing her from meeting those educational requirements and getting that license. She can do that. It's, a process, but there's nothing preventing her from doing that. There's also nothing preventing her from having licensed clinicians that work side by side with her. But anyway, the last part of what she said was a massive straw man. And I've seen so many charismatic leaders will say stuff like this, where to people that aren't familiar, it sounds reasonable, especially because she's kind of led down this road. All the gurus, or not all of them, but a lot of them will do this, where they start with something reasonable and they become become more unreasonable in an attempt to actually influence the individuals to try to gain more followers, to sell more tickets or something. And so she's saying that there's a movement to prevent people like her that don't have a license and don't have the mainstream requirements. She uses mainstream as a bad word, by the way, which I find interesting. But she is saying that she is not allowed to talk about emotions. No. Anyone can talk about emotions. That's not what we're talking about. We're talking about the treatment of conditions. That's what we're talking about.
I find this terrifying. I have always been clear about this, and I'll say it again now. I am not a doctor. I am not a licensed therapist. I'm not a psychologist. What I am is a spiritual leader. What I am is a revolutionary in the field of personal development.
Okay, I don't know anything about what she's saying there. She's obviously, what's a revolutionary?
While I can absolutely appreciate the risk of people who don't know what they're doing things that cause more harm, it terrifies me that we're trying to limit the field to only certain people being legally allowed to talk about certain subjects.
Again, you're not legally prevented from talking about a subject. You are legally prevented from providing treatment of conditions that you have literally no education around and no oversight and no accountability. Again, do we want people with no education in medicine doing surgery? I don't think we want that, right? We also don't want people with no education and oversight doing mental health treatment. I think we can agree on that. And there's nothing preventing her from getting that education. Now, I want to remind people that I'm sure some of you are Teal Swan followers. I'm sure she is a helpful person. I know she's a helpful person. I know many people who have been helped by her. In fact, many of the people who watch my content have contacted me and said that Teal Swan has completely changed their life for the better. And I believe you, and I can see why she would be helpful to people. But the things that she is saying right now is irresponsible. It is causing, I don't know, but it could cause people who actually could benefit by going to a specialist in my field to not go. Where are we then? Now, because she's painting this picture that she's literally the only person that can help you with suicide.
It scares me for the following reasons. The first is, there is a huge conflict amongst professionals about whether the brain gives rise to consciousness or whether consciousness itself gives rise to the brain.
What? Okay. So, where do I begin? Well, maybe she'll go into some detail. I'll reserve judgment.
If consciousness itself gives rise to the brain, then we cannot actually consider mind and emotions to be a purely medical concern.
I don't know what she's saying, but I think what she's saying, based on what I know of her philosophy, which is not her philosophy, or I don't know, maybe she invented it, but the things that she says and does is extremely commonplace in the New Age sphere. So, but I don't know. So based on my assumptions about her belief system, which isn't unique to her, that she's saying that consciousness, and I think she's meaning like your spirit or your identity or, who you are, if that gives rise to the brain, meaning that is consciousness a product of the brain? There is no debate in my field that consciousness of where it emerges from. Now, I could go down the rabbit hole in terms of the simplification and reduction of saying consciousness is in the brain, because if you just have a brain on its own, their consciousness would obviously be very different. We need our whole body. We need our entire nervous system. We need to be in contact with the world. You put someone in a sensory deprivation chamber and their identity and their consciousness and their perceptions get all strange, hallucinations. Who am I? What am I? And our consciousness, it evolved within a context of being on the planet and walking around. So consciousness is complicated, but I think what she's saying, which is consistent with a lot of people's beliefs, that there's a spirit that is infused in the nervous system or the body or something like this. And we can't study that, of course. There's no way to know. It's fine to believe that, I suppose, but there's no way to scientifically test that. And proposals to do so have been tested and found that there is no evidence of that. But anyway, and then she's saying because of that, I don't know, this is assuming because there is a spirit that is separate and predates the body somehow, that to treat someone's spiritual issue that results in their suicide, you can't just treat the body, you have to treat the consciousness / spirit, and thus that negates medicine and psychology that is trying to address the body. I will say that many in my field treat people's spirits. If there's spiritual psychology, spiritual psychotherapy. I have colleagues at my university that teach on that subject, and I find the subject to be fascinating. People live in whatever we mean by spiritual, but people live in a spiritual world. They frame things in a spiritual way. They're motivated and inspired, and their purpose and the meaning of their life is based on these kinds of beliefs. And so understanding that and helping people with that, not dismissing it, inviting that into the room, maybe even self-disclosing yourself, can be a big part of helpful treatment of suicide for sure.
Because if consciousness is beyond the brain can't be what we're pointing to as the problem when it comes to all mental illness, all thought processes, and all emotions.
Right. That I think confirms what I was assuming that she was meaning. And I will say that a lot of therapists, because of their misdirection, will be really phobic about bringing up topics of spirituality and religion with clients, which I try to help my trainees with. It's not often discussed in our field, but you need to consider that and to have that be a part of your treatment. You don't tell someone how to be spiritual. You don't tell someone that their religious is right or wrong, but it's a part of the overall package, the holistic package that the clients bring to the table, and might be a big part of what people are talking about. Absolutely, 100%. And a lot of therapists will incorporate that. Absolutely, 100%. There are Christian psychotherapists. There are Buddhist psychotherapists. There are New Age trained psychotherapists, licensed psychotherapists. But regardless of that, even if you had someone that didn't recognize that or didn't believe that, it doesn't really cross our minds as therapists and psychologists where the emotions are coming from. We don't go like, okay, I'm treating the brain right now. I'm not treating their consciousness or their spirit. It's just the emotions. It doesn't matter where they come from, right? We're talking about experience and prevention of suicide, treating of trauma. Where does it come from? That's a philosophical question at this point, and it's irrelevant to the treatment models. All right, well, tune in next time when I continue watching the video, and everyone out there, please take care of yourself because you deserve it. You really, really do.